And it's now time really that we deliberate this very relevant topic. Information technology truly has the potential to drive a radical transformation in healthcare. Can we please welcome him with a huge round of applause, and may I request him to kindly grace the dais. Warm welcome to you, sir. Thank you so much for taking the time out and being with us at the second NATHEALTH event as well. Ladies and gentlemen, I'm going to request Mr. R. Chandrasekhar, President NASSCOM, to also join us on the dais, and he's going to be chairing this session. A huge round of applause for him as well. I was going to request Dr. Preetha Reddy to extend floral mark of honor, but I'm going to request Dr. Sangeeta Reddy to please do the honors. And welcome Mr. C.K. Mishra. Can we have a bouquet of flowers on stage, please? Please give it to him. A huge round of applause once again. Ms. Shabnam Singh, I request you to kindly join us on stage, and please welcome Mr. Chandrasekhar with a bouquet of flowers. And may I invite our other panelists to kindly join us on the dais. Mr. Shivinder Mohan Singh, President NATHEALTH. Mr. Swami Swaminathan, Executive Chairman, Manipal Health Enterprises. Ms. Terry Bressenham, President and CEO, India and South Asia, GE Healthcare, and MD Wipro, GE Healthcare, and Governing Council member of NATHEALTH. Mr. Sameer Garde, President, Philips Healthcare South Asia. May I request Mr. R. Chandrasekharan, Executive Vice Chairman, Cognizant Technology Solutions and Chairman NASSCOM, to please join us on the dais. Mr. Girish Krishnamurthy, Vice President, Tata Consultancy Services. With that, I'm going to first request Mr. C.K. Mishra to please address all of us with his keynote. Sir, please.
A very good afternoon to all of you. And first and foremost, my thanks to NATHEALTH for giving me this opportunity to share a few thoughts with you today. It's indeed a privilege, because last year also I had this opportunity of listening to you, carried some of the messages back, some moved ahead, some haven't, but that's the way it works. And I'm sure persistent and consistent interactions like this will lead to a fruition point where policy making merges with a fair amount of aspiration. And that's the point we should really be looking at. Today on the dais we have people with tremendous amount of experience and knowledge, and I really don't want to look that side and speak, otherwise I'll falter. It would remain application of IT for IT's sake. So that is the convergence that really needs to be looked at. It has tremendous potential. It can transform the healthcare world, both, it was to say, in the public and the private sector. And perhaps has a more of a potential of transformation if the two join hands. But then what we need to do is tailor it in a manner that it suits the person who's seeking healthcare from us standing in front of us. What is it that this whole policy will mean? Does it mean reducing costs? Does it mean reducing time of care? Does it mean a marked improvement in quality? So now we are hopefully in August rolling out a new system called the Kitkari, where appropriate to the month or day of pregnancy or the child growth, the mother will automatically get an SMS and a voice message on her mobile telling her that 3 months have gone by, this is what you are to do, this is who you are to see. So now what we are trying to do is use this entire platform to not just provide service but also to educate. Educate the health seeker and educate our people who need to go to them. So, and it has indeed a transformational role which we need to consider, and we need to take full advantage of this. But eventually, this entire thing should become an important part of care provision. For a patient, for example, it should mean convenience. It should mean control over what he is doing. For a doctor, it's a different kind of a challenge. For example, on a M-health issue, many doctors have reservations, etc., and particularly in the rural areas. And for the industry, what it really means is how do you marry the two? Their aspirations, their provisions, you need to marry the two. So overall, I feel that as an industry, this is one platform where we need to really interact, join hands, invest, public and private, and move ahead. But I've always been saying that all this will not happen till we back it up with a policy formulation, and hope we are able to do that early. And I'm sure you're eagerly looking forward to listening to the eminent panelists here. So I'll leave you with that. Thank you very much.
I'm now going to request Ms. Priyanka Agarwal to be the moderator for this session. Priyanka, would you like to take over?
Good afternoon, everybody. I think it's been a total honor and privilege for BCG and for me to work with this group over the last year. I think this group has come really a long way in terms of setting it up and at least finalizing the priorities over a very short period of time. Let me actually invite Mr. Chandrasekhar to kick it off and tell us a bit more about the background and context of how this group came together and what he sees as some of the priorities going forward.
My very distinguished fellow panelists and distinguished delegates, I believe as the chairperson of this session, I have some latitude in the remarks I make. So I must say that one concern that some of us panelists had for a while was that we might outnumber the audience. But I'm delighted that there are so many of you post the lunch. And equally, I'm sure that many of the audience concern must have been how long you will be here by the time everyone finishes speaking. So we have a very innovative format where our moderator, who is proficient in this area from BCG, will pose questions. So it's a very different format. So we will hopefully be able to manage such a large number. Today, the capability and relevance of technology, I'm referring here to information and communication technology, not so much to medical technology itself. Therefore, that's their problem. But in India, since we don't have such a strong legacy, and much less the very diverse systems that they have, our problems are completely different. Aside from the monumental challenges and the scale of the challenges which Mr. Mishra has outlined, our problem is of affordability and access. And the fact that to bring affordability, we also need to combine existing technology with a heavy dose of innovation to make it more relevant and more affordable. The good news in this context is that the Indian IT industry, which has won laurels all across the world for having global service delivery platforms in many areas, including in IT and IT services, including in health and health-related services, is today characterized, especially in the last 2 or 3 years, by a very strong startup entrepreneurial ecosystem, which today is innovating, it's getting widely recognized, and it has now reached the stage where the IT industry was at the start of its journey. And one of the areas where this whole ICT innovation is taking place is in the area of healthcare. So in coming up with technologies and devices which are relevant for us and can address the burning problems in this area, I think that is a very important element which will have to be leveraged in this effort. So the point is that the relevance of these technologies is no longer the question, and that's not something which we need to debate, or as you can see from what you have heard all day long, it's not something which we need to convince each other, either in the government or in the private sector or in the IT or in the healthcare industry. The question now is the next level. That is, what can be done? What needs to be done? What are the priorities? And then how do we actually go about it? There are a lot of questions which arise in this context, and hopefully in the course of the discussions that we will have in the rest of this panel, some of these questions will be addressed. These are exactly the questions which we have been grappling with within the NNJC, and these are very lively discussions, and personally I have gained a lot of knowledge from the wealth of expertise in two very different but increasingly interrelated fields, and I do hope, and I am pretty confident, that the coming together of these two industries through the mechanism created by the industry bodies will actually help the country, help the government, and help all of us to transform this sector. And I think Priyanka will take us through the rest of the discussions, but thank you very much.
Thank you, Mr. Chandrasekhar. I think we'll invite Rama to also give us a bit of a background, and then we'll get on with the discussion.
A warm welcome and thank you to all of you who stayed back after a long day of discussions. A huge, pretty full audience. One of the reasons why this session is the last in the annual conference of NATHEALTH is because both the governing councils of NATHEALTH and the executive council of NASSCOM, which is celebrating its 25th year and they're celebrating the second year, jointly believe that information technology is a core enabler of how healthcare will address its challenges and transform patient care, and also bring all the stakeholders in the ecosystem to deliver what we believe is the vision of a converged healthcare. So somewhere in the beginning of 2014 at the NASSCOM India Leadership Forum, most of the NATHEALTH governing council members were kindly agreed to be there, and we had a joint MOU, and after the council was formed, we discussed, deliberated, came up with a bunch of priorities which our knowledge partner Priyanka will be elaborating on, and we came up with 4 priorities. Interestingly, in the right approach to the partnership, all the 4 priorities that we have shortlisted for the near term, the teams are led or co-led by one of the industry members. So for some of the priorities, an IT industry member is the lead and a health sector leader is the co-lead, and a couple of other priorities we have an IT industry member who's playing the role of a co-lead, and jointly we're working. And we are also very happy that the teams, the task force teams that have been created for developing the implementation roadmap for this charter is working very closely with government. Ministry of Health has 3 different nodal officers assigned to this NASSCOM NATHEALTH team to flesh out our ideas, brainstorm with them what are their priorities, where can we identify synergies between what government has in terms of goals of universal healthcare and what the 2 industries from the private sector are planning to deliver in the near term. So we have a couple of 4 priorities that have emerged, which Priyanka will elaborate on. So just to give you a recap on, we had an MOU signed in 2014. We have a joint council, I've already talked about that. Simply put, our focus of our partnership is about how can technology or IT be leveraged to transform the way healthcare is delivered in India. And the focus areas for the partnership or the MOU that we had signed, I don't really need to get into each of this. They'll get elaborated on the charter that we have developed on. This is what we're looking to work, and the last 1 year has been a great journey under the guidance of both Mr. Shivendra Singh and
The formidable task of keeping us on time, so I'm going to keep this very short and start getting the perspective of the panel members. We really started off on 20th of May last year, where all of us got together in person to kick it off and set the aspiration for what the Joint Council wanted to achieve. Then we met at least 3 or 4 times, had many conference calls, almost every month. And like Rama was saying, through a lot of discussion and collaboration, the group came up, first of all, with 8 priorities that they felt had the potential of having transformative impact. We looked at it across the healthcare value chain of education/prevention, treatment, and then managing. There were 7 priorities which really fell under the bucket of opportunities which could have transformational impact, and then 5 others which were identified as enablers. Good. So let me, Shivinder, kick it off with you as the president of NATHEALTH and someone who actually very passionately guided us, over the course of the last 6 months. What, in your view, are the critical challenges that healthcare is facing today, and where do you think are the most high-impact areas where technology can really play a role? And as someone who's been deliberating this and thinking about this, what are your aspirations on what can happen over the next couple of years?
I guess that sums up the panel discussion. I think I'll just start by saying that at NATHEALTH we learn very fast. We had Vijay Thilani from NIT talking earlier before lunch. So we thought we'd take some of the educational objectives into our annual day. One of the things that I hear most about education is the fact that there should be a good class teacher to student ratio. I think we've already achieved that with this panel. So we are going very well. We're probably sitting at 1:6 or something like that, which is probably global standard in some ways. So I think we must congratulate NHGC to have achieved that for us very quickly. Priyanka, I think your question is kind of a summary question, so I'll take a dig at it, but I won't go into too much detail. I think the biggest shift that we need to do in India, at least from a healthcare perspective, is mindset change. I think awareness and mindset change go hand in hand, and I think that could be a big leap forward that we could do with technology and IT, keeping in mind that we have 900 million plus mobile users and pretty much 700 million odd unique users from what I understand. And I think if we can use this association to reach them from just changing mindset, as we talked about earlier, as my health being my responsibility, we would have made a major shift just with just that one objective. I would probably list down 8 or 9 things that I don't want to talk about what challenges we face. We talk about that often enough in most healthcare conversations. So what can technology do for healthcare to solve our challenges? I think access, we talked about a little bit of that, both the comments made by Mr. Chandrasekhar and Mr. Mishra. I think how we can use technology to quality, either by the consumer scoring like we have now in most retail and FMCG products, where consumers can actually go out and score what their services have been like, or even by publishing outcomes, which we don't do much of in our country, creating faster access, improving turnaround times, and therefore being a multiplier for brick and mortar. Healthcare is a very intensive industry from a brick and mortar perspective, and I believe that technology can multiply that access and utility in that sense.
Thank you, Shivinder. I think that's a very comprehensive set of priorities you've laid out. Let me actually ask the question from the other perspective. So, Mr. Chandrasekharan, from all the work that you do in your healthcare vertical globally, where have you seen the highest impact, where technology has had a very significant visible impact in healthcare, and what are some of the learnings that you would draw from the global clients and where you've seen impact to India?
Yeah. Thank you for this opportunity. I think technology, as all of us agree, has a very important role to play in every aspect of healthcare. If I look at the work that we are doing for healthcare industry overseas, it ranges from insurance company to provider sector to pharma sector to the consumers, the patients. What is really important, where technology plays a very important role, is really connecting the dots. Really connecting the providers with the insurance companies to the patients. So it's complete value chain. And that's really a win-win solution for all the stakeholders involved in the healthcare value chain. It's a win for the patient because it's a least amount of hassle. You don't have to run from pillar to post to get your things done. And what we are also seeing, if I look at from the provider space, hospitals, it's all about connected devices. Earlier panel we talked about, can you do everything by technology? Do you need a doctor's intervention? Of course, the doctor intervention is needed, but technology can simplify the whole thing a lot better. Right? So today we are talking about driverless car, right? Because devices are able to talk to each other, understand the ecosystem, and then make adjustments accordingly. And same technology is available for healthcare. I know Philips is embarking on a major exercise where they are doing some pilot, I think in China, where they're talking about connected devices, monitoring patients and administering whatever needs to be done for the patient. So all these things can be done with the technology, with the Internet of Things. I think we need to start working on those, leveraging technology for better treatment and more importantly, the timely intervention for the patients. That's very, very important. And in the India context also, I have seen some hospitals where they are, instead of nurses going around the patient, taking the critical parameters and then recording them on a piece of paper, you give them a tablet and the patient records are sort of input into the tablet, and that is connected to the back-end device where based on the data you enter, you immediately get a message of what type of intervention you need to provide for the patient on the spot. So I think Shekhar mentioned about the problem of healthcare is about access, availability, right? If you provide the right access, even to the poor person, if you provide the right access to the healthcare, access to the right healthcare, it may be expensive, but then government schemes like Jan Suraksha Yojana and things like that, where they are trying to help patients, if they can subsidize the treatment, the citizen has the right access to the healthcare, and the payment is taken by the government so that the private hospitals or healthcare service providers are not affected. So if you can really bring the entire ecosystem for the benefit of the common man with the government welfare program, I think this can be phenomenally successful. So I see in any which way you really look at it, technology can play a very constructive, meaningful, and a beneficial role for the citizens as well as for the entire country. Thank you.
Thank you for those comments. I think the two notions of connecting the dots and innovative solutions is something we'll certainly come back to over the course of the discussion. Let me actually pick up from the comments you made and ask a question to you, Girish, who's also had experience similarly in implementing healthcare solutions in India, both in the public and private sector. What do you think are some of the areas where you see the fastest technology adoption? And on the other hand, where do you see some, further opportunities still of, in the public and private sector, within India now? So shifting focus to India now.
We seldom use technology, which is a major issue of technology consumption of our country, both in the private and public sector. For the last 24 months, if you look at it, there's a tremendous amount of improvement is happening. So the way I see that is also when you look at, there are a lot of short-term solution people look at it on the public side. Most of the when I interact with the public sector people, more the public healthcare look at mother and child care as a necessary thing. But I think India as a country will solve that to whatever the international standard in the next couple of years. But from the technology perspective, we need to look at the robust platform and some kind of applications which is digital savvy or digital India message, covering the rural, remote, wellness and preventive care mode. And I think that's a trend I see.
Thank you, Girish, for those comments. I think the message around the need to transform the healthcare in the public setting was very clear. So thanks for that. Let me shift gears to you, Terry, and since you've also had a lot of experience within the PPP space and perhaps being at the forefront of leading some of the initiatives around PPP, what do you feel is the broader opportunity of leveraging technology in the PPP area? And I know Mr. Mishra as well talked about the time is right. It's an idea whose time has come of in leveraging technology within that setting. What has been your experience, and what do you see as kind of the opportunity ahead?
Well, I think first off, in the space of information technology globally in healthcare, it will be the most disruptive enabling technology, bar none. And I think in the next 5 years, there's going to be some tremendous shifts that are going to be made across healthcare systems globally as it relates to the abilities to have data, connecting those dots, multiplexing lots of different pieces of the information puzzle in healthcare, because it is probably one of the world's most complex workflows. And that's why it's never been that easy to simplify this or to automate it or to extract the productivity that we would in, say a financial industry or a manufacturing process and such. So that's what's exciting about this. I think the other exciting part in India is the fact that we aren't sitting on a lot of legacy systems. The landscape here is, while it has lots of issues because of that, but there's a lot of opportunity for this to be crafted with a way to extract the value and do it relevant to the needs of the cost, as we spoke about, as well as access. Person's already far along in the disease cycle, therefore the cost of treat is much higher. So again, if we can push the information utilization down into patients, and again was mentioned the ubiquitous low-cost telecommunications, there's a nexus here between that and healthcare needs, and I think that's something that India could forge the way and be very innovative, and models that we can create here, in fact, indeed would be useful outside of India as well, which is another part I think is not lost on technology companies like ourselves.
Thanks, Terry. I'll pick up on the thought of starting the treatment earlier in the chain, and maybe direct the question to Sarv, as you've been leading the initiative around how can we leverage technology in preventive care. So maybe you want to share your thoughts on, what are some of the discussions you had in the group, and where do you see the initiative around getting more technology usage in preventive going?
What we've been working on is a cloud platform, if you will, as a co-creation activity among some of the service providers and the ecosystem players as well. What that does is to, on one side, connecting electronic health records and the devices, act as a middleware for the devices to come together. Both on the hospital side as well as the consumer-centric ones, and on the other side, bring some of the advancements in technology, like machine learning, expert systems, and the efforts around automating clinical pathways, data-driven clinical pathways, all of them together, and apply the platform, use case like chronic care reporting that they can use for better planning and resource allocation. The early stage, but for all of that to scale, as I learned from one of the previous panels, business model innovation needs to happen as well.
Great, thanks. I think that's very fascinating, and innovation is exactly, I think, the theme of the day. So let me ask Anand, as a company focused on innovation and building on what Sarv just said, what do you see as the one or two, extremely innovative ways to create this leapfrog that we've been talking about, in healthcare, leveraging technology?
Clearly there is a lot happening in the market, and if one were to go to the CES last week, you would have seen lots of activities. And in the India context also, and I've been working with the remote healthcare part of the initiative here, there are lots of opportunities and lots of different experiments being carried out all over the place. Because it's fairly easy to do an experiment. You can run Skype and you can get started. However, I think if we want to scale this problem, I think one of the big things that we need to focus on is standardization, and figure out a way how we can interoperate some of these components that people are building out or that are available. And I think this is where an ecosystem that can be built using a NATHEALTH NASCOM platform would be very relevant, because it would be very important that all the innovators and the startup ecosystem that we have in the industry is able to contribute to an incremental platform that gets built, rather than everyone trying to do something from end to end, because that would not work. And I think this is an opportunity for us at NATHEALTH and NASCOM to work together to find a way to create the necessary standards so that we can interoperate with the components and the technologies that are going to be in any way available in the market. And we've been trying to explore some of this stuff internally at Persistent as well, and I think we'd be happy to contribute more in this area.
Sure. Thanks, Anand. Let me also get some comments, Samir, from you, again, as a company which has globally been sort of innovating a lot in healthcare, and some of the solutions that you're working on in India, on your thoughts as well on the same.
Yeah, thanks, Priyanka. But I really don't want to use this forum to talk about Philips and what Philips is doing. But I think it's very interesting that I'm a non-healthcare guy in the healthcare industry for less than half a year, and a few things kind of stood out, and I'll use 3 examples for elaborating on what I want to say here. I think if you look at 11th February 2014 was a landmark year for the healthcare industry, because if you look at it, polio got eradicated in India. And a lot of people don't talk about that from a technology perspective, because absolutely no technology was used to eradicate polio in India. That industry, in fact, a bank can't work without technology. And I think that's where healthcare probably needs to be 10 years from now, right? Can you have a situation where a public health system or a secondary care facility or a primary care facility or a large hospital cannot work without technology? Now, when you come to that stage, that's when technology is really embedded into the core of that ecosystem, so to say. I think the point I'm trying to make is that I think if you look at technology solutions for this industry, one, it needs to be focused on a few problems that we need to solve in a very, very focused manner. And India is capable of solving those problems when we remain focused on certain things. So let's say when you choose diabetes as a problem that you want to solve, it's not very proud to be told that you're the diabetes capital of the world, right? So if you decide that you want to solve that problem, let's say the way we solve the polio problem, I don't see any reason why we can't solve that. So I think pick on certain key focused issues in healthcare, see how technology can enable that, and maybe use the banking example that we've had over the last 30 years to, the one thing that I keep saying, for example, to a lot of people who are in healthcare is from an IT perspective. Most banks, most big banks in India, the core banking systems are not managed by small IT players. It's either Infosys or TCS. It's either the Finacle system or the TCS core banking system which manages that core banking. And I think healthcare needs these big IT players to enter in a way where they can automate it so that it becomes impossible to work without that, right? So I think that, in my opinion, is probably just a very different perspective on how technology can enable solving health outcomes and improving health outcomes in India.
Great, thanks. I think we've really touched on 3 or 4 very important notions through the course of the discussions today. The power of technology to connect the dots and create a convergent platform. The second one is pushing treatment and healthcare up the chain, starting really earlier than when it is an acute problem. Solving problems at scale, and how can technology create that scale. And fourth, Samir, which you mentioned around standardization, how can some of these big players create standardization so that then it becomes, adoption almost becomes a necessity rather than a choice. Out of these, Swami, let me sort of focus the last question at you, and out of these many different points that we've made, what would you pick as literally the 2 focus areas over the next 2 years where you would be, where, as an aspiration, you would really like to see progress, and, you feel that those are the 2 critical areas where if we progress, we will have all felt successful and proud of what we've achieved together?
Good, thank you. It's sort of nice to be asked as to what should healthcare be doing, because after 10 years speaking from NASCOM panels, telling people what they should be doing, it feels sort of strange to be in a NATHEALTH forum and, being in the other side of the table. But having said that, I do believe, in the 18-20 months, I've been a part of the hardcore healthcare industry, if you will. Very clearly, some things have stood out. Something that I sort of internalized before even I moved into the healthcare from the technology space. Clearly, the affordability and accessibility thing that we've been continuing to talk about, how are you going to ever achieve it was a big question on my mind, continues to be a big question. I do believe that the rubber has to hit the road when we can actually aggregate a lot of these islands of excellence, which is already there. It's not that we have to wait for innovation for the future. I think if we can bring together all that we already have, I think healthcare will start looking even much better.
Thank you, Swami, for those inspiring words. I think I will not attempt to summarize it all, as we exactly sort of had time at 5 o'clock. But just say that there is certainly tremendous opportunity, but more importantly, tremendous passion, as is clear from the number of people on this stage. So I would just like to thank the panelists very much for sharing their perspectives and passionately devoting their energy to the cause. Thank you, and I'd also just request the audience to thank the panelists. Thank you. And then any final words from you? Would you just like to say a few words?
No, thank you, Mr. Chandrasekhar, which I said in the morning, and Mr. Chandrasekhar also. And I think later.
I have a prerogative to say last two sentences. I thought I would say at the end that we were greatly delighted by the kind of response that we got from NATHEALTH. It's been a wonderful experience working together. And thereafter, we also worked with the government. And the response that we got from the government was tremendous. And when we concluded our first meeting, the Secretary said, I want at the end of my tenure to be known for having got this piece, namely technology enablement in healthcare. That should be the hallmark of my tenure in this ministry. I thought that was a very ringing endorsement, and I think the involvement of a number of senior officers confirmed that, and it's been repeated thereafter almost every month. So I would like to thank Mr. Shivendra Singh, Anjan, Dr. Pratap Reddy, Sangeeta Reddy, who had given us so many nice comments, and all the team. The amount of energy and commitment is really unbelievable. We set a great store by what we are trying to do, and I'm quite hopeful that it will have a good impact in the years to come.
Kindly join us on stage and accept. Thank you very much, sir, for gracing the occasion with your presence. Thank you, ma'am, for doing the honors. And ladies and gentlemen, with that, I'm going to take this opportunity to once again request Mr. C.K. Mishra to share his views on ethics in healthcare. Mr. Mishra, if I may request you to kindly join us on stage and share your views on ethics in healthcare. Once again, a big hand, ladies and gentlemen.
Thanks. I really didn't know this was coming my way. Oh, well, it's particularly difficult talking about ethics in health at the fag end of the day. We should have begun with this. It really finds a vital place. And, I don't really think we can define or write a chapter and do's and don'ts on what ethics in health is all about. Each one of us who's in the healthcare delivery system should be able to actually enunciate what our ethical duty to the person who's seeking services from us. Thank you.
Thank you very much, sir. And ladies and gentlemen, I now request Dr. K.K. Agarwal to share his views on ethics and also Indian Medical Association's perspectives on ethics in healthcare.
Thank you, NATHEALTH, for inviting the platform of Indian Medical Association to join hands with NATHEALTH in the subject of ethics, a subject which is very dear to me. I am in the State Medical Council for the last 10 years. I am in the Medical Council of India Ethics Committee for the last 1.5 years. And I have a practical experience of handling over 1,100 cases of medical negligence, complaints against the doctors, hospitals, and nursing homes. So I have a first-hand experience of what is ethics and what is not unethical. And today I have taken, for the last 2 weeks, I have taken charge of Indian Medical Association as the Secretary General. 1,700 branches, 30 state branches, 250,000 doctors, and we communicate to 200,000 doctors every day.
and we communicate to approximately 20,000 medical leaders on a regular basis through SMS and through our electronic mails. We have code of conduct for doctors, but we don't have code of conduct for pharma. From 1st of January, Ministry has come out with some code of conduct for pharma. In a healthcare provider, I think today we are going to sign up that we are going to come out with healthcare provider, with the NATHEALTH, we are going to come out our own code of conduct before the government comes out and they start giving us nasty code of conduct. We still don't have digital code of conduct. I'll expect Anjan to talk to us and we can come out with a digital code of conduct, because every day today now is, every day some site is coming that we will give you business, you enter give us your name and everything. Then we don't have a protected health information digital code of conduct we are trying to make. We don't have a code of conduct with a pharmacy and a chemist. Lot of things we need to come out with. Now what I expect from NATHEALTH today, I don't want to come out with what is ethical, we all know. Close your eyes, ask your heart, whatever comes is the code of conduct. Because your heart will never say, take commission, take cuts. Your mind will say, but your heart will never say. And that's the first principle of Dharma, Artha, Kama, Moksha. Therefore, what we want to come out is, can we come out with a code of conduct of a different kind? Once we come out with this, and that is what is not unethical. Why can't we work together and come out with a grievance and remediation cell at the level of the first care provider so that we can handle the patient's complaint at that particular moment? Last thing is, if all of us believe in 4 words, before we treat, is it the truth? Is it necessary? Will it bring happiness to my heart? Not to me, to my heart. Will it bring happiness to others? If the answer to all 4 questions is yes, that is called ethics of medical practice. So I'm very fortunate and happy and grateful to all of you. I didn't want to lose this opportunity to talk to you from my heart, from my emotions. And I'm very grateful to Anjan and our leader, Professor Reddy, sitting here, to have involved, to work together. Let's work together in the field of ethics and come out so that the dignity of the medical profession comes back. Thank you very much.
Dr. Agarwal, I have to request you to join us back on stage. I have to actually hold you here, and I have to request Mr. Ranjan Bose, Secretary General NATHEALTH, to kindly join us on stage. And as we heard, now is the moment, ladies and gentlemen, when NATHEALTH and IMA are going to be signing a memorandum of understanding. We request you to sign and exchange the documents. Once again, ladies and gentlemen, can we please hear it? For NATHEALTH and Indian Medical Association coming together on ethics in Indian healthcare. Thank you very much.
Front page and the last page.
Front page and the last page. Signatures in place, ladies and gentlemen, and
thank you.
Thank you for your apologies. Thank you very much, gentlemen. Doing the honors, ladies and gentlemen, it's Behram, Dr. Arvind Lal, Mr. C.K. Mishra, and, ladies and gentlemen, Dr. K.K. Agarwal, to unveil the pledge. May I request Mr. Ranjan Bose to also join us on stage, please, and do the honors.
Hold the strings. Ready, sir?
All right, big round of applause, ladies and gentlemen. The pledge is now unveiled. I would now, in fact, urge members in the audience to take the oath. Sir, if we may start with you.
I want voluntary and collective commitment to follow ethical practices to ensure that patients are provided access to high quality, cost effective, safe and efficient technologies, products and services.
To comply with all applicable government laws and regulations and member companies and internal policies on the subject to create a mechanism to address violations appropriately.
Or appears to conflict with the interests of the healthcare community and end users or the patients who are the most important.
Maintain a safe and healthy work environment.
Provide donations only for charitable purposes and not with the intent to influence the healthcare community to purchase, lease, or recommend the use of specific products and services for treatment modalities.
Meet appropriate delivery of healthcare services.
Undertake appropriate dissemination of the code for full applicability and accountability.
Thank you, ladies and gentlemen. Big round of applause for the members of the audience taking initiative. I now request our volunteers to bring all the microphones on stage, and I would request the leadership team here with us on stage to take the pledge together. And ladies and gentlemen, the pledge is also going.
We, the members of NATHEALTH, do hereby solemnly pledge to maintain ethical and transparent business practice and thereby ensure improved access to and better quality of the healthcare ecosystem.
Ladies and gentlemen, may I request you to please rise for the next. Ladies and gentlemen, in contributing to the pledge, give yourself a big round of applause. Thank you so much. Thank you, esteemed dignitaries, once again. Thank you, ladies and gentlemen, for being an integral part of NATHEALTH's second annual event. And with that, we request you to join us for tea, coffee. The day is brought to an end. Ladies and gentlemen, members of NATHEALTH are requested to join us at Mehtab for the annual general meeting. We would like to thank once again our knowledge partners, Bain & Company, and PR and event managed by Impact PR. Thank you very much once again.
After the GC, we have some big refreshments and cocktails. We will clear ahead to 8 o'clock. I will request Shushuman Das Gupta to take his seat. I will request Arvind Lal sir to take his seat, Anjan Bhatt sir to take his seat, Shirendra Mohan sir and Rajan Padukan sir and Nand Kumar Jairam sir. Please be on dais. Mike please.